Hello, and today we are looking at the heart, function of the heart, and how to diagnose heart diseases and laboratory tests involved. So, what is the heart? So, your heart is in essence a muscle, and it's located a little bit of the left to the middle of your chest, and it's about the size of your fist. It's like a pump, and it pumps blood around your body, and the blood provides your body with the oxygen and nutrients it needs, and it also carries away waste. The right side of your heart receives blood from the body and pumps it to the lungs, and the left side of the heart receives blood from the lungs and pumps it out to the body. The functions of the heart are to pump blood and oxygen around the body and deliver waste products such as carbon dioxide back to the lungs to be removed. So the heart is made up of 4 different blood flow areas, and each of these areas is known as a chamber. There are 2 chambers on each side of the heart. One chamber is on the top and one chamber is on the bottom. The 2 top chambers are called the atria, and the heart has a left atrium and a right atrium. The 2 chambers on the bottom are known as the ventricles, and the heart has a left ventricle and a right ventricle. The left hand and right hand side of the heart is separated by a wall called the septum. The purpose of the septum is to separate the left side and the right side of the heart. The atria and ventricles will work as a team. The atria fill with blood, then dump it into the ventricles. The ventricles then squeeze, pumping blood out of the heart. While the ventricles are squeezing, the atria will refill and get ready for the next contraction. So as mentioned before, the right side of your heart collects blood on its return from the rest of your body. The blood entering the right side of your heart is low in oxygen, otherwise known as deoxygenated blood. Your heart pumps the blood from the right side of your heart to your lungs so it can receive more oxygen. Once it has received oxygen, the blood returns directly to the left side of your heart, which then pumps it out again to all parts of your body through an artery called the aorta, and this is oxygenated blood. Blood pressure refers to the amount of force the pumping blood it sets on the arterial walls. The heart's walls consist of 3 layers of tissue. So the myocardium is known as the muscular tissue of the heart, and this is composed of 3 components: the endocardium, the pericardium, and the epicardium. The endocardium lines the inside of the heart and protects the valves and chambers. The pericardium is a thin protective coating that surrounds the other parts. And the epicardium is the protective layer, which is made up mostly of connective tissue and forms the innermost layer of the pericardium. Let's now have a look at the blood vessels of the heart. So, firstly, the arteries. As mentioned before, these carry oxygenated blood from the heart to the rest of the body. Arteries are strong, muscular, and stretchy, elastic, which helps push blood through the circulatory system and also help regulate blood pressure. The arteries will then branch into smaller vessels called arterioles. Also, another blood vessel of the heart is known as the veins. These carry deoxygenated blood back to the heart, and they increase in size as they get closer to the heart. Veins have thinner walls than arteries. And finally, there's capillaries, which connect the smallest arteries to the smallest veins. And these have very thin walls which allow them to exchange compounds such as carbon dioxide, water, oxygen, waste, and nutrients of surrounding tissues. So those are the types of blood vessels you can get. Now let's look at specific blood vessels of the heart. So firstly, you have the coronary arteries, which sit on the surface of the heart and supply the heart muscle with blood and oxygen. You have the aorta, which is the largest artery in the body. This has oxygen-rich blood which is pumped into the aorta from the left ventricle, and the aorta divides into various branches which deliver blood around the body. There's pulmonary arteries, where blood low in oxygen is pumped by the right ventricle into the pulmonary arteries that link to the lungs. You have pulmonary veins, in which the pulmonary veins return oxygen-rich blood from the lungs to the left atrium of the heart. And you have the vena cava, in which you have deoxygenated blood delivered to the right atrium by 2 veins. One is known as superior vena cava, which carries blood from the head and upper torso, while the other, known as the inferior vena cava, carries blood from the lower body. The heart has 4 valves to ensure that blood only flows in one direction. These are known as the aortic valve, the mitral valve, the pulmonary valve, and the tricuspid valve. So the aortic valve is between the left ventricle and aorta. The mitral valve is between the left atrium and the left ventricle. The pulmonary valve is between the right ventricle and the pulmonary artery. And the tricuspid valve is between the right atrium and the right ventricle. Look further into the heartbeat in detail. The left and right sides of the heart work in unison. The atrium and ventricles contract and relax, in turn producing a rhythmic heartbeat. The right side of the heart receives deoxygenated blood and sends it to the lungs. The right atrium receives deoxygenated blood from the body through the veins called the superior and inferior vena cava. These are the largest veins in the body. The right atrium contracts and blood passes to the right ventricle. Once the right ventricle is full, it contracts and pumps the blood to the lungs via the pulmonary artery. In the lungs, the blood picks up oxygen and offloads carbon dioxide. On the left side, this receives blood from the lungs and pumps it to the rest of the body. Oxygenated blood returns to the left atrium via the pulmonary veins. The left atrium contracts, pushing the blood into the left ventricle. Once the left ventricle is full, it contracts and pushes the blood back out to the body via the aorta. Each heartbeat has two parts, diastole and systole. In diastole, the ventricles relax and fill with blood as the atria contract, emptying all blood into the ventricles. In systole, the ventricles contract and pump blood out of the heart as the atria relax, filling with blood again. With regards to blood pressure, once a person takes their blood pressure, the machine will give a high and a low number. The high number is known as systolic blood pressure and the lower number is known as diastolic blood pressure. The systolic pressure shows how much pressure the blood creates against the artery walls during systole, and the diastolic pressure shows how much pressure is in the arteries during diastole. When blood travels through the pulmonary artery to the lungs, it passes through tiny capillaries that connect on the surface of the lungs air sacs called alveoli. The body cells need oxygen to function and they produce carbon dioxide as a waste product. The heart enables the body to eliminate the unwanted carbon dioxide. Oxygen enters the blood and carbon dioxide leaves it through the capillaries of the alveoli. The coronary arteries on the surface of the heart supply oxygenated blood to the heart muscle. With regards to your pulse, a person can feel their pulse at points where the arteries pass close to the skin surface, such as on the wrist or neck. The pulse is the same as the heart rate. When you feel your pulse, you will feel the rush of blood as the heart pumps through the body. A healthy pulse is usually 60 to 100 beats per minute, and what is normal can vary from the person to person. A very active person can have a pulse as low as 40 BPM, but people with a larger body size tend to have a faster pulse, but not usually over 100 BPM. So to pump blood throughout the body, the muscles of the heart must work together to squeeze the blood in the right direction at the right time with the right force. This is coordinated by electrical impulses. The electrical signal begins at the sinoatrial node, sometimes called the sinus or SA node. This is known as the heart's pacemaker and it sits at the top of the right atrium. This signal allows the atria to contract, pushing blood down into the ventricles. An electrical impulse then travels to an area of cells at the bottom of the right atrium between the atria and the ventricles called the atrioventricular or AV node. These cells act as a gatekeeper. They coordinate the signal so that the atria and ventricles do not contract at the same time. There has to be a slight delay. From here, the signals travel along fibers called Purkinje fibers within the ventricle walls. The fibers pass the impulse to the heart muscle, causing the ventricles to contract. Now let's have a look at conditions of the heart. So coronary heart disease is where coronary arteries supplying blood to the heart muscle become blocked or narrowed by a buildup of fatty deposits known as a plaque, and this can cause angina and heart attacks. Angina is a buildup of plaque in the coronary arteries, and part of the heart muscle may not receive enough blood and oxygen. This causes chest tightness, discomfort, or pain. Pain or discomfort may also be felt in the arms, neck, jaw, shoulders, or back. Heart attack. This is where a blood clot cuts off the flow of blood to the heart. Without oxygen and nutrients, the heart muscle begins to die. A heart attack may not be fatal, especially if you receive immediate medical treatment, but it can still cause lasting damage to the heart. Heart failure, a condition where the heart is not able to pump blood and oxygen around the body as well as it should. Arrhythmias, also known as abnormal heart rhythms. This is a range of conditions where there is a fault in the heart's electrical system which affects your heart's pumping rhythm. Atrial fibrillation is the most common type of abnormal heart rhythm where the heart beats irregularly and often fast. There's heart valve disease when the heart valve or valves don't open or close properly. Damage to the heart valves can make it harder for the heart to pump blood around the body. There's congenital heart disease where problems of the heart or blood vessels that you are born with. Problems include the blockage of blood flow inside the heart or blood vessels, abnormal flow of blood within the heart, or the heart may not have developed properly. There's heart inflammation, including pericarditis, which is inflammation of the outer lining of the heart, and myocarditis, which is inflammation of the heart muscle. And there's also rheumatic heart disease, which is damage to the valves in the heart that develop after acute rheumatic fever. Symptoms of heart disease can be chest discomfort or pain, and it can last for several minutes or come and go. There's shortness of breath or difficulty breathing, with or without chest discomfort. There's palpitations, where you have a racing heart or a feeling your heart is pounding or fluttering in your chest. There's lightheadedness, dizziness, feeling faint, feeling anxious, anxiety, nausea, indigestion, vomiting, and sweating or a cold sweat. There are a lot of different lab tests which are carried out to investigate diseases of the heart. There's a cholesterol test, also known as a lipid profile, which measures fat in the blood. And this involves total cholesterol, which is the amount of the blood's cholesterol content, and a high level can raise the risk of heart disease. There's LDL cholesterol, low dense lipoprotein, in which too much of this causes plaque to build up in the arteries. The build-up cuts blood flow and leads to heart and blood vessel conditions. There's HDL cholesterol, which is high density lipoprotein, also known as good cholesterol because it helps keep bad LDL cholesterol away from the arteries. This keeps the arteries open and blood flowing more freely. There is triglycerides, which are another type of fat in the blood, and high levels of these can increase the risk of heart disease. There is non-high density lipoprotein, and this is total cholesterol minus HDL cholesterol, which equals non-HDLC. Non-HDLC is involved in plaque buildup in the arteries, and this is a better marker of risk than total cholesterol or low-density cholesterol. There's also C-reactive protein, which is highly sensitive. The liver produces C-reactive protein as part of the body's response to injury or infection. This response causes swelling inside the body called inflammation. Inflammation plays a major role in the buildup of plaques in the artery called atherosclerosis. There's also plasma ceramides testing, where this measures the levels of ceramides in the blood. All cells make ceramides. They play a big role in the way many types of tissues grow, work, and die. These are also linked to atherosclerosis. Free ceramides have been linked to plaque buildup in the arteries and insulin resistance, which can lead to type 2 diabetes. There's natriuretic peptides. So the main one is brain natriuretic peptide, which is a protein the heart and blood vessels make. This helps the body get rid of fluids, relaxes blood vessels, and moves sodium into the urine. With heart damage, the body puts high levels of BNP into the blood to try and ease the strain on the heart. And there's also troponin, which is a protein found in heart muscle. This is a high sensitivity troponin T-test will help diagnose a heart attack, and it also shows the risk of heart disease. There's also an increased level of troponin being linked with a higher risk of heart disease in people who have no symptoms. For the final part, we're going to look at myocardial infarction. So infarction is definition is the process by which necrosis, cell tissue, or death results from ischemia, loss of blood supply. So this, in essence, this is a loss of blood supply to the heart from the coronary arteries. When myocytes die, they break up and release their contents. A host of enzymes have been used at one point or another to act as a biomarker for myocardial infarction. These include aminotransferases ALT and AST, lactate dehydrogenase LDH, creatinine kinase, and myoglobin. These enzymes are rarely used today as they are not specific for cardiac damage and do not rise early enough for effective myocardial infarction management. Main biomarker for troponin, if the main biomarker for myocardial infarction is troponin. Troponin complex is exclusively present within striated muscle fibers. This is composed of three components: troponin I, troponin C, and troponin T. There are three isoforms of troponin T and I, one of which is specific to the myocardium, and this is C troponin I and C troponin T, and these are used as markers of myocardial infarction. The advantages of using troponin is that it's highly sensitive. The percentage of troponin released that reaches the blood after cardiac injury is greater for troponin than for any other marker. It has a longer duration, and it stays elevated for longer and is useful in the diagnosis of myocardial infarction 12 hours post-event. It is highly specific as it is located only within the myocardium. However, a disadvantage could also be its specificity, as other causes of elevated troponin include pulmonary embolism, congestive heart failure, and sepsis. But it is specific for troponin. It is specific for myocardial infarction. Also, a disadvantage is reinfarction. So suspected reinfarction cannot be reliably detected by troponin for at least 2 weeks. And there's also assay interference. Presence of heterophilic antibodies can cause erroneous high CTN1 values in a healthy patient. That's the end of the video today. I hope you have enjoyed it. Please feel free to comment, like, share and subscribe, and leave any comments underneath and any further videos you would like to make. Thank you very much for taking the time to listen. Thank you. Bye bye.